Prackies, happy Friday. Hope everyone's had a really good week and you've all got some nice R&R scheduled for the weekend. Okay, so Christine wanted me to have a chat about abdominal examination in general, in particular why we do it and what we're actually looking for. So, abdominal is a really important aspect for us natural health prackies, because obviously one of our thoughts is that everything starts in the gut. So obviously being able to case take appropriately and do abdominal examination is really important. Okay, so why? Because everything starts in the gut. And also because, being able to do a abdominal examination in terms of inspection, palpation, auscultation, percussion, tells us a lot about what's going on, and we can really identify any red flags, anything that we consider to be serious pathology, and things that just, might warrant some further investigations. And also we do it to back up something that we are suspecting, and we might want to just have a little bit of a feel or a listen or just to back up what we've sort of been thinking is going on. So what are we looking for when we do our abdominal examination? We're feeling. So we're feeling for tenderness, we're feeling for any guarding, which is involuntary engagement of the muscles, and it's something that the abdominal muscles will do to stop you from palpating and going into an area that is tender or has some inflammation or something like that going on. Or is there just outright pain? And one of the little sneaky little things that I will tell you about this is that kind of like, the person that goes, oh, no worries, but really you can tell there is a bit of a worry. When you are doing abdominal examination, please make sure that you're looking at your patient's face and not just at the abdominal area, because they may be saying no, I don't feel any pain, I don't feel any tenderness, but their grimace will be saying something completely different, and that's something that I find people tend to miss. Okay, so tenderness, guarding and pain. The other thing, obviously, and this is something that could be a red flag, it could be further investigation or a warrant for a referral, is lumps and bumps and masses. So that's another really important one when we are feeling. And then obviously we go through and we question more about that lump and bump. We also feel and feel to see if it's if any of the red flags are coming up for us and we think it should be investigated further. The other thing that we look for when we're doing this is for enlargement of organs. So we do the Murphy's sign to see if there's any inflammation of the gallbladder, and we're also seeing if the liver itself is actually enlarged and coming down into the abdominal area, and the same with the spleen, which is really kind of quite serious if we can palpate a spleen. When we're actually palpating around the colon and the intestines, we can actually ascertain where the same when we're doing like listening for bowel sounds and how many in the minute. We can ascertain whether there's constipation, whether there's diarrhoea, whether there's early stages of constipation. And especially when we're feeling around and we can feel lumps and bumps, but they tend to move around under our fingers, we can kind of, as we would expect, there should be some feces moving through the colon. But, having said that, it should not be completely impacted and hard. Okay, the other thing, obviously, when we're listening for bowel sounds, as I mentioned, we can ascertain for constipation, diarrhea, and early stages constipation. And we can also check for absent bowel sounds, which is quite a serious situation and should be treated as such. So also when we are inspecting, palpating, percussing and auscultating, which is listening, we can detect things like ascites, which is fluid retention in the area and quite serious, as opposed to obesity. We can, as I mentioned, we can look for gallbladder enlargement, inflammation, pain and tenderness, and we can also, we can detect some liver issues, which would mean that our case taking would go in a different direction. So they are some of the things that we will be looking for abdominal examination, and the reasons why we do it. So we really deep dive into this in the workshops. You walk away with a complete plan about how to do all of these examinations, when to do them, why you will do them, and what to do when different things come up. So please don't forget to check that out. I am coming to 8 cities, so I will be coming near you. There's no doubt about it. Okay, so I hope that was beneficial to you guys. Please leave me some comments, or if you've got some questions, hit me up. And I will see you next week.